people aren't Googling cancer for fun. And so they most likely know nothing about it until the moment that they're diagnosed. And then all of a sudden, there's this need and desire to have as much information as they possibly can.
New choices, new players, new models of care. You know, consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo, or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Hey, welcome back to the leading podcast about consumer-centered health. We highlight innovators who are bridging the gap between sick care and well care, influencing change in the industry, and empowering consumers with cool new ways to engage in their health and wellness. We're also having some fun along the way. I'm Jared Johnson, and this is episode 459. Today, we have the Flava of the Week about rebuilding consumer trust in healthcare. What lessons did the MDRG team share with our community, and just how much has trust dropped since the pandemic? I'll talk about that. Then Mindy Grantham shares tons of insights from her experience as a marketing leader for some of the most well-known cancer centers in the country. You'll finish this episode feeling hopeful that we can make cancer journeys consumer-centered, and you'll have a little more empathy for patients who struggle navigating a system that wasn't built for them. It's time for the awesomeness. Are you ready? Let's go. Flava of the Week. Trust is at an all-time low, and we need to address this fact in healthcare. That was the theme of the Healthcare Rap community's October Spotlight call featuring MDRG's VP of Growth, Christy Roldan, and their president and founder, Sandra Brown. They presented findings from their newest research on this topic, which concluded that in its present state, healthcare faces eroding institutional trust driven by access issues, poor transparency, and the mixed impact of technology. They extended a challenge for leaders to improve access, enhance transparency, increase accountability, and balance innovation with a human touch to rebuild trust and strengthen patient outcomes. It was a highly engaging discussion, and here are my 10 key takeaways. Number 1, as I said before, trust in healthcare is at a historic low. Only 24% of Americans believe hospitals prioritize patient care over profits. That's a 50-point drop since before the pandemic. Number 2, the COVID-19 pandemic reshaped public trust. An early surge of confidence gave way to skepticism as misinformation spread and unified public messaging disappeared. Number 3, access is the foundation of trust. Complex scheduling, long waits, and barriers to seeing providers make patients feel undervalued, which erodes confidence before care even begins. Number 4, AI presents both opportunity and risk. Patients distrust AI when it lacks transparency. They want to understand where and why it's used, and they want to maintain human oversight in their care. Number 5, trust in people remains stronger than trust in systems. Patients often retain faith in individual providers, even as institutional trust declines, showing that human connection is still healthcare's greatest asset. Number 6, younger generations demand more. Gen Z and millennials expect healthcare experiences to match the convenience and transparency of other industries, leaving little patience for outdated processes. Number 7, transparency and accountability are critical. Patients want honest communication about pricing, AI use, and treatment options, and they respond positively when organizations admit mistakes and show progress. Number 8, billing complexity fuels mistrust. Surprise bills and opaque pricing reinforce the belief that hospitals prioritize profits, even when insurers are the cause of many denials. Number 9, marketing and communication can rebuild trust. Authentic storytelling that emphasizes real clinicians and patient experiences helps humanize care and restore emotional connection with patients. And number 10, trust drives brand loyalty and market share. When patients trust a system or provider, they give them a greater share of care. Declining trust directly correlates with lost loyalty and revenue. So there you go. I want to thank the MDRG team again for sharing these insights. As you can see, we're having some great discussions in the community, so I invite you to join our next Spotlight call on November 6th featuring Dr. Gordon Chen. Community events are free to attend. They just require a login, so you can see the link in the show notes or reach out directly to me. It only takes a few minutes to create your account. Let's consider how each of us can actively move the needle to restore trust in healthcare. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the Week.
Healthcare Rap is sponsored by Cyril. Whether you're trying to drive patient volume as a healthcare provider, boost membership enrollment as a health insurer, drive improved adherence rates in pharma, or deepen strategic B2B partnerships throughout the healthcare ecosystem, Cyril can help you with your go-to market efforts and growth targets, enabling you to reach the clinical and financial goals of your healthcare organization. For more information, go to Cyril.com. That's CYRALL.com.
The flow.
All right, everyone, let's get into the flow. I'm so excited to have Mindy Grantham with me today, and we have a lot to talk about in terms of making cancer care more consumer friendly, and I'm excited to dive in. So let's welcome Mindy to the Healthcare Wrap.
Thanks, Jared. I'm excited to be here today.
Let's help our listeners get to know you a little bit better, though. You want to give us maybe the 2-minute version of who you are and what you do?
I am an oncology marketing strategist who spent my career helping the most complex parts of healthcare become more human and a lot more understandable. I started in med devices at Boston Scientific in their cardiac rhythm management division, where I learned to translate highly technical innovation into adoption. And then from there, I moved over to Rocky Mountain Cancer Centers, which is a part of the U.S. Oncology Network. And at that time, the practice needed to regain share and rebuild trust with both physicians and patients. So we reimagined the marketing funnel around access. So we wanted to be able to align patient outreach, referrer communication, and appointment readiness so that patients could move from awareness to care faster, with programs later adopted in multiple markets. But most recently, I served as marketing director for Mayo Clinic Comprehensive Cancer Center, where I led enterprise-wide strategy, demand generation, clinical trial accruals, and community outreach and engagement. So sitting at that intersection sharpened my lens on what truly moves the needle in oncology, which is making access faster, navigation clear, and then the science in plain language so that the right patients can get the right care and the trials at the right time. Oncology is personal for me. I'm a survivor, and so it's where science and humanity collide every day. I'm super passionate about borrowing the best of retail and digital consumerism and bringing that into cancer care, because I believe that when we design around the patients and the caregivers and not just the system, care becomes more accessible, more equitable, and ultimately more effective. So that's why I'm excited to be here today, because I want to be able to take this specialty and make it feel less intimidating and talking about redesigning it to be connected and compassionate and consumer friendly.
First off, thank you for being here and being able to kind of infuse your own story and your own experience in clearly, which is already part of this conversation. So you've had the opportunity to work with and experience yourself a lot of cancer care teams and how they are attempting and working with consumers. So patients, caregivers. I think we'll get to each of these audiences one by one. I'm sure you've just seen a lot in terms of how things are working well. Let's start there. Like, what are cancer care teams doing well right now, especially when you're talking about some of the things you just mentioned with access and outreach and education?
I think right now that cancer care teams do an incredible job at what I would consider kind of the hardest part of healthcare, where we're bringing science and humanity together. It's that compassion and collaboration between the oncologists, the nurses, the navigators, and each case is complex. Everyone is so different. And so that, for me, is what they're doing really well right now.
What about the flip side of this? Because I do think this opens up a bit of our conversation in terms of like where cancer care teams have room for improvement.
100% agree, right? For me personally, I think we're able to see opportunities for the most improvement moving forward would be reducing friction and increasing access. So with most new cancer patient diagnoses are in older adults. About 57% are 65 or older, and nearly 9 out of 10 are over 50. So that means that we're caring for people who often struggle to navigate systems that weren't designed for them. So right now, I'm a caregiver for my aging mother. And it's really difficult, right? She's not able to access portals or do the endless phone trees, do the delayed callbacks, all of those issues that are in the system today. And so reducing friction here isn't just like a nice to have, but I think that it's a necessity for this population. But then when we start talking about the tech that would be able to resolve some of these issues, my mom wouldn't be able to handle some of the advanced technology either, right? But if we think about the next generation of patients, they're the ones who've grown up with all of these digital tools. So they will expect seamless and tech-enabled care. So I think that we have an opportunity right now to build for both of those realities, high touch as well as high tech. But there's also a truth in terms of operating margins are tight, and there's a staffing shortage that's only getting worse, right? That means that every new service or technology either has to generate return on investment or it needs to be reimbursable for it to be sustainable. And so that's when we start looking at, like, how do we get people to do screenings earlier so that there is a better outcome? Because the earlier cancer is diagnosed, the better the outcomes. That's proven in science over and over again. And then what do we do in order to make care easier if we look at care in home?
We're saying, like, there are a few different areas here, and I'm latching on to the part about understanding today's patients versus the next generation of patients and how their expectations will be different. I mean, they already are different, but they're not the same size of demographic that is currently experiencing a cancer journey, if I heard that right. So we talk about access, we talk about friction, and you're talking about just kind of like the digital engagement here. These aren't, again, I'm going to have to keep recentering myself because this isn't a transactional thing. It is different than other tech investments that health systems, providers, hospitals are making. It's more complex. It's even more emotionally charged. I mean, healthcare, the baseline healthcare experience is more emotionally charged than most other transactions that we experience. So we're just talking about, levels of complexity here, which always leads me to, like, where do we start? Where are those first steps? Where do we go if I would suspect a lot of members of cancer care teams know that their process or the system isn't perfect? They hear it every day. They experience it every day. What's been your experience here in terms of, like, where do we start to design something better?
I think that when we start talking about cancer care being consumer friendly, I think that screening is really where the rubber meets the road. The easier we make it to get screened, the more people do it and the better the outcomes. But historically, screening has been built around the system's convenience and not patients. So if we look at an example of Kaiser Permanente was mailing colorectal cancer screening tests, fecal tests to people's homes, they doubled screening rates. They went from about 37% to about 80%. Cutting colorectal cancer deaths in half. So if we look at, like, just at-home convenience and the proactive outreach, you end up with higher adherence and lower disparities. And it was easy, right? Like, so easy for people to do these tests in home. Another example is being able to do mobile mammography. So people, like, where there's mobile mammography, units bring screening to churches, community centers, rural areas. So they're reaching populations with historically low screening rates. So now we're meeting patients where they are. It combines clinical access with the community trust, and it expands reach to medically underserved communities as well. So when we start talking about these two examples, especially because with colorectal cancer, the incidence and mortality rates are much higher in Black men. And Kaiser Permanente, through that service, they were able to see both of those reduced and essentially close that gap between the races. So there are things that we can and should be doing. We have the science and the data that proves that they work.
Hey y'all, I'm here with Sina Arham, founder of Friday's Health. Sina, what do you think is broken in the traditional approach to metabolic health, and what are you doing to flip the script?
Let's be honest, the moment in metabolic health is being driven by the GLP-1 receptor agonist class of medications, right? We finally have something that is addressing metabolic health, obesity, and type 2 diabetes in an elegant fashion, right? It's efficacious, it's manageable for patients. And so I think we're having our moment in metabolic health in that the old guard of tackling metabolic health and obesity has a lot of stigma attached to it, a lot of shame and blame and guilt.
Thanks, Sina. Visit joinfridays.com for more information and tell them you heard about it from the Healthcare Wrap. What are some of those other dimensions that are part of that vision?
For me, one of the big ones too is the ability to get an appointment as soon as possible. You kind of hinted at this previously, where it's emotionally charged. Cancer care is always high anxiety, right? And I often tell people when I'm talking about oncology marketing, because I'm a geek, is that it's different from most other marketing period and healthcare marketing as well, because it often feels like life or death. And in most cases it is, right? But people aren't Googling cancer for fun. And so they most likely know nothing about it until the moment that they're diagnosed. And then all of a sudden, there's this need and desire to have as much information as they possibly can. And so this is where, especially within marketing, that I try to create the clarity, set expectations, helping patients and caregivers feel like someone is walking beside them from that very first call. But a part of that is being able to get in to be seen as quickly as possible. Because like when I was told that I had cancer, the first thing that I wanted was out of my body, right? And it was early. It was an early diagnosed cancer. So I wasn't at risk, but you don't feel that. You don't know that. And all you know is that you want it out. And you want to be seen tomorrow. And so one of the things that City of Hope did is they set up the opportunity to be seen within 24 hours of the next day. It reduces the anxiety. Should be that expectation, right? But what we find is that even at places where I've worked, appointments would be weeks out. So now what happens is that a patient will take the first available, even if it's weeks out, but they will continue to shop. They will look for an earlier appointment. And then what happens is if they find an earlier appointment, they will do a no-show because we've made it super hard for them to cancel that appointment. So now you've lost that patient and you've lost that revenue because they did a no-show, and you, of course, can't fill that.
How often does it happen? And it turns into a conversation of, well, what else can we do with the assumptions that are made, I guess, right? Without the data to show like they were continuing to shop, right? It turns into a conversation about how do we improve the tech to change the outreach because, hey, they did commit to an appointment. So yeah, why is it a no? It falls into a generic no-show bucket, I guess, right? Versus what's actually going on here.
I've seen that at the practices that I've worked at. The truth is, the faster and easier we make it for patients to get to that first appointment, the more likely they are to stay with your system and start treatment without delay. It makes financial sense for the practices to get patients in faster.
Sure does. So one other dimension you had mentioned earlier was mailing kits to people at home. Where else does in-home care fit into this?
So I would love to see more in terms of in-home care. So like I'd said at the beginning, I started at Boston Scientific and Cardiac Rhythm Management. This was in the early 2000s. And we were doing pacemakers, defibrillators, those kinds of things. And we had in-home monitors then. It's not that the technology didn't exist or doesn't exist. We just have been slow to adopt it in cancer care, right? But Mayo Clinic has started what they call Cancer Care Beyond Walls. And it is a good proof point that we can safely deliver parts of oncology treatment at home. So combining like infusion nurses, remote vitals, and a command center that's always watching and do it successfully.
It's big. I will just tell you one of the themes over these last probably 3 or 4 years on this show, as we brought on some of those who work in this space, in the at-home space, it is so clear when this comes back to one of the emotional touch points of a journey, of a health journey, almost everyone would rather be at home just because a hospital is just uncomfortable. It's anxiety provoking. It does not help you feel comfortable for the most part. And it has nothing to do with the care that you receive. And I think that was a part of the conversation that I wasn't hearing a few years ago. A lot of these things just come up as we're focused on the consumer aspects of healthcare. And it's part of the conversation that I always like to get to. So I'm glad you brought that up. A couple of other aspects of it, I would guess you've alluded to them as well, just digital engagement as well as Tele-oncology is another piece as well. How do those two pieces fit into this vision that you've been creating?
Yeah, the tele-oncology is definitely a part of it, right? Because what we know is that patients don't need to be seen physically a lot of times by the physician. If we have those in-home monitors looking at vitals, being able to ask questions of symptoms, those kinds of things, tele-oncology is great, especially when you start thinking about, at the beginning of the podcast, we talked about the age of the patient, right? And so now they don't need to travel as much because they're typically sick. They will normally need a caregiver to go with them as well, which can be really hard because most care still happens between 8 and 5. But then when you also start looking at how many patients are rural, one of the things that I didn't realize, because I'm more of a city kind of a person, but with rural populations, one of the things that they don't like is having to drive into a city. They worry about things that I just consider sort of normal in terms of like even parking in a parking ramp. But so then we end up with stressors that aren't even just about the care itself, but about how to go to get the care. So what are those types of services that we can do in home and still be able to keep patients healthy and doing well? All of the data so far from all of the reports for whether it's Mayo Clinic's Cancer Care Beyond Walls or the other services that are being delivered at home now, the outcomes are just as good or better than, because of they are lower stress. There's that less travel. They're at home, so they're comfortable. And so it points in a positive direction.
Yeah, these are vital parts of this vision. When I'm thinking about kind of where some of these stakeholders can learn these lessons and kind of borrow them from, I do think about retail. I think about digital consumerism. And I wonder if you agree with that, if there are lessons that you think oncology practices can learn and borrow from those areas as well. Like, are there things that oncology practices can learn from those areas?
They've been trying to do some of the screenings at retail centers, the ability to do the access, immediate access. So you start thinking about, what are we borrowing from retail? What are we borrowing from like Amazon? It's interesting though, because for me, Amazon continues to try to do healthcare and they have yet to figure out what that model looks like. So, and they've just been trying to do primary care, right? They haven't even tipped their toes into oncology yet. So oncology might be sort of the last frontier when we start talking about total consumerism. And there will, of course, always be parts that can't be delivered in home. Well, today, right? If we think about radiation treatment, that today, unless they're doing the pellets, you can't be doing that at home. But even then, but it's a hard space to start thinking about consumerism. But I do think about all of the wearables. I don't think that each of the cancer centers needs to create their own, right? So where can we start partnering? Because when you start looking at things like the Aura Ring and being able to see what's happening in the body and being able to predict what's going to happen, and you start pairing that with other in-home devices that are looking at symptoms and side effects of the treatment, I think that there is a way to do this so much better in the near future.
I mentioned I wanted to ask about caregivers. So I want to make sure I do. Caregivers are so vitally important here. So what tips do you have for including caregivers in the cancer patient's journey?
So just like I talked about my mom and I am the caregiver for her, I'm the one doing the searching, right? I'm the one that's looking for information. I'm the one that's scheduling the appointments. And so what information can I give to those caregivers along that full journey? What information do they need at each of those different points along the journey? And what are we doing for them to have an outlet as well? So my mom doesn't have cancer, but she has Alzheimer's. And so a lot of the things that I've been engaging with right now are support groups. And I think that those are one of the things that we need to be doing more for the cancer caregivers as well. It takes a toll. It really does. So it's not just about making sure that they have the information and the ease of access, but what are they doing for self-care?
It helps. We can spend more time as an industry is kind of where I would go with this, of making sure we're including, like, and hearing those experiences not just thinking about the patient journey, because there's a lot there too. But it's, again, one of the reasons why this isn't a simple answer and a simple like checklist of, cool, now this is consumer centered or it's more consumer friendly. And I think that's kind of where we've gotten with this. Before we can build it, we have to design it. We have to know what this should look like and what some of those key parts are. And that's what you've been able to share with us today. So I only have one question for you as we start to wrap here, which again, it tends to be one of the more personal questions, but it's one of the ones I like asking, which is, what gives you hope for the future of healthcare in our country? I always preface it by saying, I wish we were asking this more often to everyone who works in the industry. What about you? What gives you hope for the future of healthcare?
I am optimistic about 3 big shifts that I see that are finally lining up. The first is we're redesigning around people and not places. So we've proven that when you make prevention and access easy, so when we talked about those mail-in tests or mobile units, next day appointments, those kinds of things, engagement jumps, right? And we see a change in the incidence levels as well as mortality rates. I see that as kind of the first. The second, the feedback loops are getting smarter. So we used to just rely on those office visits, but now we can combine those patient-reported symptoms with the passive signals from wearables. So that means earlier outreach, fewer crises, and care that follows you and not the other way around. And then third, we're matching heart with sustainability. So when we think about staffing is tight, margins are thin, but we're seeing models that are both patient-centered and operationally sound. So faster time to first appointment, the navigator programs that prevent leakage, and then the in-home care that frees clinic capacity. So add to that a new generation of patients and caregivers who expect the clarity, convenience, and transparency. I think that the future looks bright. We're keeping the science world-class and making the experience finally feel human.
I love it. What a place for us to conclude here, Mindy. It's been a pleasure. I want to thank you for giving us so much to think about, for setting a vision for us, and for everything you're doing to make healthcare consumer first in some very important areas. Thanks for joining us today.
Thank you for having me. It's a pleasure.